Do you experience heavy, cold, weak, or tingling legs, especially at night or after walking for just a few minutes? What if I told you that in some elderly people, this discomfort doesn't just start in the veins or arteries, but also in the silent lack of an essential vitamin for blood and nerves? Today, I want to talk to you about vitamin B12, a vitamin small in name but gigantic in importance, for those who want to age with more energy, balance, and greater attention to the signals their legs give them. In this video, you'll understand why vitamin B12 can be so important for seniors who experience leg fatigue, numbness, tingling, weakness, or a feeling of poor circulation. But please note, this video is educational, does not replace medical consultation, and does not promise a cure. Leg pain can have various causes, including serious circulatory problems. The goal here is to help you recognize the signs, avoid common mistakes, and communicate better with your doctor. So if you enjoy educational videos like this one, which is 100% aligned with current medical guidelines, subscribe and join this community. Know someone who should watch this video? Then share it with them. That said, let's get to what interests us. Imagine a 72-year-old woman. She begins to feel heavy legs, cold feet, and a strange sensation like tiny needles crawling on the soles of her feet. At first, she thinks, it's just old age. Then she starts walking less, getting up from her chair less often, avoiding leaving the house, and believes that her circulation has simply become weak. But upon further investigation, she discovers that some of those symptoms were linked to a vitamin B12 deficiency. Do you see the danger? Sometimes the body screams, but we call that scream old age. Before continuing, please like and subscribe to the channel and send this video to an elderly family member who frequently complains of tired legs, numbness, or tingling. This information might help them seek evaluation at the right time. And write in the comments, do you feel more heaviness in your legs, tingling, or pain when walking? This difference is important because each sign can point in a different direction. Now let's debunk a common misconception. Many people believe that all leg problems are due to poor circulation. Numbness? Poor circulation? Burning sensation? Poor circulation. Weakness? Poor circulation. But the body doesn't work in such a simple way. Heavy legs can be related to venous circulation. Pain when walking that improves with rest may be related to peripheral arterial disease. Tingling, loss of sensation, electric shock sensation, imbalance, and weakness can involve nerves. And that's precisely where vitamin B12 comes into the picture. Vitamin B12 is not a magic vitamin that opens blocked arteries. It does not replace guided walking, blood pressure control, or diabetes management. It does not replace cholesterol treatment, smoking cessation, or medical follow-up. Its role is different. B12 participates in the healthy formation of blood cells and helps maintain the nervous system. When B12 is lacking, the body may have difficulty producing adequate red blood cells and the nerves may suffer. The result can manifest as fatigue, weakness, numbness, tingling, balance problems, and strange sensations in the legs. Think of vitamin B12 as the electrical and logistical maintenance of a city. Blood is like the delivery system, carrying oxygen to the most distant neighborhoods. Nerves are like electrical wires. They carry messages from the brain to the feet and bring sensations back. When B12 is lacking, part of this logistics can slow down, and part of this wiring can fail. The person feels that their leg doesn't respond as before, or that their feet feel numb. Walking has become more insecure. It's not imagination. It's a sign that deserves attention. And why is this so common in older people? Because as they age, some people absorb vitamin B12 from food less efficiently. In addition, certain medications, stomach problems, very restrictive diets, low intake of animal products, and some digestive conditions can increase the risk of deficiency. A person may even eat the vitamin, but not absorb it properly. It's like putting fuel in a car and discovering that the engine isn't using the fuel correctly. The most important signs to watch for are these: persistent tingling in the feet or legs, numbness, burning sensation, difficulty maintaining balance, unexplained weakness, unusual fatigue, paleness, shortness of breath on exertion, rapid heartbeat, worsening memory, and mental confusion in some cases. A single sign alone does not confirm a diagnosis, but several signs together raise a red flag. And a red flag does not mean panic. It means stop, observe, and investigate. Now comes an essential point. There's a difference between leg pain due to an arterial problem and leg pain due to a neurological disorder. In peripheral arterial disease, a common condition in the elderly, a person may feel pain, tightness, or fatigue in the calf when walking, and this pain improves when they stop. This may indicate that the muscle is not receiving enough blood during exertion. In B12 deficiency, the symptoms may seem more electrical: tingling, numbness, prickling sensations, loss of sensation, and imbalance. Both can coexist. Therefore, guessing at home is dangerous. The number one mistake is buying supplements on your own, thinking that will solve any leg pain. The number 2 mistake is applying ointment, drinking tea, massaging, and ignoring progressive symptoms. The number 3 mistake is thinking that after 60, it's normal. Just because something is common doesn't mean it should be ignored. Aging doesn't mean accepting loss of mobility without investigation. True prevention begins when you respect the small signs before they become big. Let's talk about the 3 categories of signs you should distinguish. The first category is circulatory signs. Very cold legs, changes in foot color, slow healing wounds, and pain when walking require medical evaluation. The second category is neurological signs. Tingling, numbness, electric shock sensations, loss of balance, and difficulty feeling the ground. The third category is general signs. Extreme fatigue, weakness, dizziness, shortness of breath on exertion, and worsening memory. Vitamin B12 may be more related to the second and third categories, but the doctor needs to evaluate the whole picture. How can you tell if you're deficient in B12? It's not by looking at it or based on an internet video. The safe way is to talk to a professional and request a proper evaluation. The doctor may order a blood count, vitamin B12 levels, and investigate diabetes, thyroid function, or arterial circulation. The leg is where the symptom appears, but the cause may lie in the blood, nerves, blood vessels, or metabolism. Do you know any elderly person taking stomach medication for years? Or someone using metformin for diabetes or eating little animal protein? These situations require closer attention to vitamin B12. Never stop medication without guidance, but talk to your doctor about monitoring. Nutrition also matters. Vitamin B12 occurs naturally in foods of animal origin, such as meat, fish, eggs, and dairy products. People who follow vegetarian or vegan diets need to talk to a professional about fortified foods or appropriate supplementation. In the elderly, sometimes the problem is not just consuming too little B12, but poor absorption. Therefore, in some cases, the doctor may recommend oral supplements or other forms of replacement. But the dose and form depend on the cause, the tests, and the individual condition of each person. Now, I want you to remember this metaphor. Your legs are like the end of a long road. If there's a problem with the asphalt, the car shakes. If there's a lack of fuel, the car loses power. If the wiring fails, the dashboard goes crazy. In your legs, the asphalt could be the circulation, the fuel could be the oxygen in the blood, and the wiring could be the nervous system. Vitamin B12 doesn't fix everything, but it can be essential for keeping the blood and nerves functioning better when there is a deficiency. Preventive advice number 1, walk, but walk safely. For many older adults, regular movement helps preserve mobility, muscle strength, and vascular health. But if leg pain appears while walking and improves when stopping, this should be investigated. Preventive advice number 2, don't ignore persistent tingling. Tingling that lasts for days, weeks, or worsens over time should not be treated as just a sign of aging. Preventive advice number 3, take care of your metabolic control. High glucose, high blood pressure, altered cholesterol, and smoking are major enemies of blood vessels and nerves. Preventive tip number 4, observe your feet. Elderly people, especially those with diabetes, should check their feet frequently. Small wounds, changes in color, cracks, loss of sensation, and unusual pain deserve attention. Preventive tip number 5, do not mix supplements without guidance. Even vitamins can cause confusion when used incorrectly, especially if the person is taking multiple medications. The goal is not to take more things. It's about taking what is necessary with professional guidance. The goal is to take the right thing for the right reason, at the right dose, and for the right amount of time. When should you seek urgent medical attention? Seek immediate care if you experience sudden, severe leg pain, a suddenly cold or pale leg, sudden loss of strength, a dark wound, significant swelling in one leg, shortness of breath, chest pain, or difficulty speaking. These signs may indicate serious problems and should not wait. Also seek evaluation if tingling is worsening, if there are frequent falls, if the person is losing sensation in their feet, or if there is pain when walking that limits their daily routine. And here's the part many people don't want to hear. There isn't a single vitamin that solves leg circulation problems in all elderly people. This statement is attention-grabbing, but real life demands responsibility. Vitamin B12 can be a crucial factor when there is a deficiency, mainly due to its relationship with blood and nerves. But healthy legs depend on a combination of factors: proper nutrition, movement, control of chronic diseases, sleep, hydration, medical evaluation, and attention to warning signs. My golden tip for today is vitamin B12 supplementation. In the elderly, should only be initiated after laboratory confirmation of deficiency. The most common mistake is treating a symptom in isolation. B12 is essential for nerve health and blood cell production, but it does not correct circulatory problems, such as peripheral arterial disease, where pain improves with rest. If you suspect a deficiency or experience progressive symptoms in your legs, the scientifically correct step is not to self-supplement, but rather to seek medical advice. Request a full evaluation that includes measuring B12 levels and investigating other causes. The right course of action is to investigate, not guess. So, to summarize, if you feel weak legs, tingling, numbness, unusual tiredness, or a strange sensation in your feet, vitamin B12 should be part of the investigation, especially in older adults. But it should not be seen as a miracle. It should be seen as a clue, an important clue. A clue that can change the conversation with your doctor and help prevent symptoms from being treated simply as a natural part of aging. If this video made sense to you, leave your like, subscribe to the channel, and share it with someone who often says, "My legs are not the same anymore." In the next video, I will explain the signs that help differentiate true poor circulation from nerve problems, because understanding this difference can help you act earlier, more safely, and with less fear. I am Robert Tournier, researcher in preventive health and longevity. My goal is to help you stay well informed about your health. Take care of your legs today, because they carry your freedom tomorrow. A big hug. I'll see you soon. Bye.